Coming up, we will be on location at Virginia Spine Specialists in Manassas, Virginia, discussing the benefits of artificial disc replacement, a breakthrough in spinal surgery that can help minimize and even eliminate the debilitating back and neck pain that so many people experience, with one of this region's top neurosurgeons, Dr. Mudit Sharma. Dr. Sharma received his medical degree from the University of Buffalo and completed his residency training from Georgetown University. He is also a fellow of the prestigious American Association of Neurosurgeons, among other organizations, and is widely recognized as one of this area's leading neurosurgeons. Welcome, Dr. Sharma. It's a pleasure having you on our program again.
Thank you. Thanks for inviting me again, Rocco. Appreciate it.
We've got a lot to talk about. We have a patient that's going to be joining us a bit later, but I wanted to begin, Doctor, if I may, by having you tell us what artificial disc replacement is, because it's certainly a breakthrough and can help so many folks out there.
Certainly, Rocco, and it's a very exciting development in the field of spine surgery. Traditionally, we have been only able to offer patients fusions for problems of the neck if they ever need surgery. But recently, the advances in spine surgery have allowed us to actually replace the disc artificially, recreate what the patients originally are supposed to have, and eliminate the need for fusions and instrumentation. And by doing this, the patients have more motion, normal motion of their necks, and also less problems with other segments of the spine that can potentially get more loading if they're fused. And so this technology allows us to replace the disc as it was meant to in the nature.
That is a tremendous breakthrough. It's taken it to a whole different level as far as treating folks with these problems.
Yes, and this technology has been constantly evolving. This is not new. Yeah. It is being done for almost a decade now, but has finally come into its own with the latest advances that we are now doing.
And how, Dr. Sharma, is this procedure performed? What is a patient looking at?
So this is ideally done in patients who have failed several weeks of conservative therapy. As we have always said, conservative therapy is my first and foremost goal with every patient of mine. When they have failed conservative therapy, they would typically undergo a surgical procedure that is done as an outpatient, and in about an hour-long procedure, a patient who's been suffering from debilitating neck or arm pain can get this procedure done and sometimes even wake up without pain and have a artificial disc where the bad disc used to be.
Very interesting. Now, what would you say are some of the key benefits of this procedure as opposed to the traditional spinal fusion surgery that a lot of folks are familiar with?
Sure. So the biggest benefit here is it is quicker, so there's less time under anesthesia. It is minimally invasive, so there's less instrumentation that goes with this. And the patient's natural body motion is preserved, which means that the deterioration of the rest of the spine is slowed, and the pressure on the adjacent levels, the levels within this problematic area, are preserved as well.
So some significant advantages with this procedure over spinal fusion surgery.
Definitely. This is the state-of-the-art 2013 version of spinal surgery.
And who would you say, Dr. Sharma, would be a good candidate for the artificial disc replacement surgery?
So at this point, we are considering all ages and candidates for this. Anybody who has a bad disc disease causing arm numbness and neck pain would be a good candidate for this. The only exceptions would be anybody who's been in a traumatic motor vehicle crash or an accident.
And what type of results can we expect from this treatment?
This is a very powerful technique. This is a very, very robust treatment pattern where patients are getting results the same day or within a week where they wake up without arm or neck pain. So this is a very powerful and very immediate results that are seen with this technology.
Well, speaking of results, we're now going to meet Magda, who's a patient of Dr. Sharma. Welcome, Magda. It's a pleasure having you on our program.
Nice to be here.
We always appreciate it when patients take their time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, Magda, by asking you if you can please tell us problem or problems that you were going through that brought you here to Dr. Sharma?
Well, I had an accident at work, and I went to all their doctors, and they all told me that I was going to be in pain for the rest of my life, that not to be such a baby. And I had a very small surgery, but it was worse than anything. And I had not slept in a bed for 4 years. Could only sleep in a recliner, because once I lay flat, I couldn't. And if I were to walk, it hurt. If I was to stand too long, it hurts. I was in pain like 24 hours a day, and it just would not let up. And it got to the point where it was affecting me mentally and physically. They referred me to another pain clinic, and he did, I don't know, about 3 years of nerve blocks. I had tranquilizers, muscle relaxers, Oxycontin, patches, all kinds of things. You know, a machine that will pulsate for you and did everything. Nothing worked. I was getting worse. And then my leg started. And now my leg is worse.
Oh, I'm so sorry to hear that. So obviously it was getting worse. It was certainly not getting better. No. And then the pain had even evolved to your leg.
Yeah, well, they told me from the first surgery that they did, they hurt the nerves on my right leg. And it's hard to walk on it. The pain gets really bad, and it gives out on me. But the pain that I was on my back, I can't even explain it to you how bad it was. I would cry and cry and cry, and nothing would do. I was taking Oxycontin in the beginning for every 6 hours. I went up to 3 hours, and all the other pain pills. And it was just, I didn't know what to do or where to go, where to turn.
So then your next step was you came to Dr. Sharma.
Oh yeah, thank God. Really do, because somebody told me about Dr. Sharma, and they told me try him. So I called, and Cammy made me an appointment right away, and he ordered some MRIs and some other things, and I went to see him, and he says, you need surgery. And I said, really? I said, can you get me out of pain? And he says, I can get you out of pain. And I think that gave me the hope I didn't have, because I was ready just not to live. I didn't want to live like that. And just him saying that, it was just like music to my ears, you know? And he says, well, we'll schedule it. Well, here was scheduled for August, but he made a space for me in July. So on my 70th birthday, he operated on me. And I can tell you, it was like heaven on earth, because he took the pain away from my back. And I never thought I would ever in my life have that pain taken away. And for the first time in 4 years, I have been sleeping in a bed for 2 weeks now. So I am just so grateful to him. I just cannot thank him enough. There's not enough doctors like him that really care and can really do something to help someone in such a condition, and not tell them that it's their mind, or, you know, you're just a baby or anything like that. But they actually look into it, and they do take the time and the caring, and just him, you know, giving me hope was all I needed. And he did. And I tell you what, I will tell everyone I can tell that he is the doctor to go to if you have anything like that. Don't suffer like I did for 4 years and cry and want to take your life, because it's not worth it. Not when you can find someone like him. I mean, I owe my life to him. I really do.
Well, very overwhelming what you just told us, Magda. I'm so happy and thankful to God that your pain is gone. Oh, you have your life back. Yes. You can sleep again. Yes. You've got your mind, and every part of you is feeling complete again, as opposed to the horrific thoughts, as you just mentioned, and depression and pain and suffering that you were going through for 4 years.
And I had to give up everything. Yeah. I couldn't do nothing. I just stayed in my room. and
Yeah.
I just couldn't function. I couldn't function.
He brought your life
And-
back for
yeah.
you through the surgery.
Yes. And
Eliminated that debilitating pain.
I know, and he said in 6 weeks after I finish with my physical therapy, if it's still bad, he'll look into that.
Yeah.
So I'm looking forward to that too.
Well, that's wonderful. I'm so happy
Yeah.
to hear that. And,
Yes.
and lastly, before I let you go, for all the folks out there, Magda, what would you tell them about your experience with the staff here as well?
Oh, there's no words I can put into that, because there's not good enough words to tell you. The girls were the best I have ever been to any office that of doctors. They cared, they were concerned, they called. I mean, the love that they had for me was unbelievable, and I could never return that, because nothing I have can give enough for them. And like I say, they're just a perfect group.
Well, on that note, I'd like to thank you again for joining us and sharing your experience with us, Magda, and being a guest on our program.
Oh, it was my pleasure to tell you what a wonderful man he is.
It was our pleasure having you on. We're now back with Dr. Sharma. You have transformed Magda's entire life. I mean, here, what a powerful, powerful interview. She spoke from her heart, her soul. She had contemplated suicide, no reason to continue living, and she came here, and you have totally brought her back.
We are very, very pleased to have been able to help Magda. She indeed was suffering quite a bit before she saw us, and thankfully we were able to find a minimally invasive solution for her problems, and she's done tremendously well with it. We are very pleased with her results.
You're like an angel. You're a healer. You really are. Not to mention, obviously, a leader in your field, but you really, Magda is one of several, many folks that you're helping on those levels on a regular basis. Great work, Dr. Sharma.
Thank you very much, Rocco.
Now, are the results permanent that a patient experiences from this procedure?
Yes, an artificial disc technology has been developed to last the patient's lifetime. It has been tested extensively in the laboratory to last all the thousands of motions that a patient's neck will undergo. So yes, it is meant to last a lifetime.
And are there any follow-up visits that a patient would be recommended to attend after they've had this procedure, just to see how they're progressing and so on and so forth?
Yes, all of the patients will get radiographs, x-rays at least twice, and will see me in the office at least 3 times. And then depending on how they're doing, how well they have done, continue to see me or be done seeing me in about 3-month mark.
Before we let you go, Dr. Sharma, I also wanted to ask you if you can briefly tell us about the spinal cord stimulation technology that you utilize here as well, and how that can help folks out there.
Sure, that'll be my pleasure, Rocco. I wanted to touch base on this real briefly. A lot of the patients that come to see us have had, unfortunately, unsuccessful surgeries elsewhere, and when there is no unique solution to their problems, we're able to mask their pain with a computer chip that is implanted directly into their spinal cord. And it is a computer that is hooked up to a battery which is all implanted within. It's a very exciting technology that we're using for folks who have what we call a failed back surgery syndrome, where they have had surgeries that were not successful. And here is an example of a battery that would be permanently implanted, and this has got an inbuilt computer system that will control the patient's pain. And this is the only thing that goes in the patient, along with cables that look like this. And this technology is very exciting because you can trial this in an office before it is permanently implanted. And by doing that, you can get a sneak preview of whether or not this is going to help you before we permanently implant it. So it's one of the very few treatments in medicine where you can take something for a test drive before you buy into it.
It's a great option to have, Doctor. Certainly state-of-the-art all the way across the board to help the folks out there through the advances in technology and spinal cord stimulation. There is an example as well.
We are very excited about this.
Yes. And on that note, I'd like to thank you, Dr. Sharma, for joining us and being a guest on our program. We'd love to have you back for round 3 in the future.
It'll be my pleasure. Thank you, Rocco. It's
Thank
good to be
you.
here.